When a patient presents with a field defect, it may be difficult to know if it's affecting one or both eyes. A patient may say they cannot see with the right eye, but in fact they're having difficulty seeing to the right side. That is, the right-sided field of both eyes is affected. It is important to try and determine if this is indeed the case. For example, this patient has a right-sided hemianopia associated with a stroke. They may, however, interpret this as it being a problem with the right eye. If the field loss affects only one eye, this indicates a problem either with the retina, such as retinal detachment, or branch retinal arterial occlusion, or a problem in the optic nerve, such as non-inflammatory ischemic optic neuropathy, or open-angle glaucoma. Remember to check pupil reactions before the pupils are dilated. Optic nerve disease causes an afferent pupillary defect, which may be quite subtle to detect, and a field defect, which is particularly marked when tested with a red object. Fundoscopy will usually reveal any obvious retinal cause, such as retinal detachment. If field loss is central, be it sudden or gradual, then the problem lies in the macula or the optic nerve. The patient may have other symptoms suggestive of macular disease, such as micropsia, where objects appear smaller in that eye, or metamorphopsia, where straight lines look crooked. The optic nerve may appear swollen, as with recent ischemic optic neuropathy, or pale if more chronic. Compression of the optic nerve will also cause disc pallor. Compare the nerve in the right and left eyes. This can help to highlight disc abnormalities. If a field defect is gradual and peripheral, then the likely cause is glaucoma damage to the optic nerve, usually affecting both eyes. Remember that patients with open-angle glaucoma may retain excellent central vision in spite of widespread loss of peripheral field of vision. Careful viewing of the optic disc will reveal it to be cupped. Again, compare the discs in both eyes. Patients may have lost a great deal of peripheral vision before a field defect is noticed. If both eyes are affected by a field defect, this suggests damage to the visual pathways behind the optic nerves. For example, a bitemporal defect caused by a chiasmal compression from a pituitary tumor, or homogeneous defect caused by a stroke. Always ask yourself, when faced with a bilateral field defect, could there be a neurological cause of the defect? In summary, determine if one or both eyes are affected. Beware of the pitfall of mistaking being unable to see to one side as being a problem with the eye on that side. As always, take a full history to see what other symptoms are present. This may help identify the cause of the problem. The message is, field defects indicate serious disease. Examination and, if necessary, investigations will, however, usually lead to the diagnosis.